The ancient Greek physician Hippocrates is frequently credited with the foundational concept of dietary therapy. Therapeutic diets provide a clinical alternative by manipulating nutrient intake to directly counteract the chemical shifts caused by a specific medical condition. This protocol is not a generic internet meal plan. It is a medical strategy devised and monitored by a registered dietitian. Through this clinical lens, the contents of a meal function as a direct physiological intervention. Before any nutrients are prescribed, a dietitian must construct a comprehensive diagnostic blueprint of the patient. This assessment relies on 5 pillars: medical history, physical and functional examinations, dietary history, and psychosocial history. This critical metric maps social and emotional factors influencing eating habits. Practitioners use this data to identify specific attitudes that hindered the patient's past health goals. Biological interventions often fail because they ignore the human element. A therapeutic diet is engineered to function within the patient's actual behavioral reality. Once the data is gathered, the dietitian begins formulating the plan by adjusting 4 specific mechanical levers. First, targeted restriction reduces nutrients like sodium to manage blood pressure. Second, nutrient loading increases elements like iron or calcium to address deficiencies. Third, portion engineering controls food mass to regulate blood sugar. Finally, chrononutrition synchronizes meal timing with natural rhythms to optimize absorption. This methodology is used to manage metabolic and cardiovascular conditions, including type 1 and type 2 diabetes and heart disease. It is equally vital in treating gastrointestinal disorders like celiac and Crohn's, as well as supporting patients through cancer recovery. By adjusting these 4 variables, a dietitian converts standard ingredients into precise biological triggers. A properly executed therapeutic diet does more than address symptoms. It can actively halt the progression of chronic medical conditions. As the body stabilizes, many patients find they can significantly reduce their dependence on long-term pharmaceutical medications. This result requires a holistic approach, combining diet, exercise, and behavioral change under the guidance of a qualified professional. Before making significant dietary changes on your own, consult a registered dietitian for a personalized medical assessment. The most effective medicine available is often already on our plates. It simply requires a clinical strategy to be effective.